So Arnold, just give us a thought. So you've been out of the department for a little bit. You've been watching, you've been working with community-based organizations and working with residents. What do you see is happening in Alameda County and in the world that we need to pay attention to?
I think the issue of race is not talked about enough. That's a sticking issue. When one says Black Lives Matter, if I'm Latino, I say, well, do I matter? You know, or I'm Asian, says do I matter? So one of the things, we really need to have a race conversation because there's this seething underneath. So I think that's one of the things that we certainly need to do. I think that I really appreciate what the Public Health Department is presently doing, reaching out in the community, because I believe that you work for the community. And I believe that you work for one of the most awesome organizations in Alameda County for sure, but in the nation. I mean, you are a leader of the nation, and it's so interesting because you don't hear about that. The people that I went with Cuba with, they knew about the Alameda County Public Health Department and the work that you're doing. But somehow we don't credit ourselves with the awesomeness that sits in this room. You make a difference in people's lives every single day, and you don't know it. And I just want to tell you, because my ears to the grindstone always. So I'm proud of you. You should be proud of yourself. So I just think going down the road that you're going down, reaching out to some of the communities that are really impoverished across racial lines, people that are catching help, because the people who are getting locked up or shot are poor people. And so poverty is a major issue in our community. Our children are a major issue. We have, so in Cuba, 96% of the population is educated. They've reached, the average person has reached the 10th grade level. By 2020, the average person will have graduated high school in Cuba. Why? They made a commitment. In Cuba, 100% access to health care. So I won't tell the whole story, but one of the members of the delegation of APHA had a tapeworm, right? And he told me last Tuesday, what he said, I have animals coming out of me. I thought he was joking, so I said, elephants, zebras, giraffes. And so he said, it felt like that. I said, too much information. And so it happened to be this 2-foot-long tapeworm. So he got treatment right away. He didn't have to say, well, where's your card, Mr. And so let me see your card, and now what kind of treatment? He just went and was treated. And so that's one of the things that I want you to fight for in this county. I want you to fight for 100% access, because I think it's important. It is unjust that we don't have total access in the county for every single person. I should not get better care than other people because I have the resources. And I need you to fight for that. I need you to fight for the schools that our children get properly educated, because I can tell you for the first 3 years of school, you learn to read. The next period of time, you read to learn. And if you haven't learned to read, then you're going to drop out. And I need you to fight to make sure that all kids get educated. So I mean, there are a number of things I think you could do that I just think that you're the right people to do it. You have a tremendous voice, you have a good leadership, and you just have to do it.
Makes it sound easy, doesn't it? But he's right. You were right.
If you can dream it, you can do it.
See, we didn't get that saying in the video.
If you can dream it, you can do it.